And hello, welcome to Hot Seat. My guest is no stranger to this program and others. Jeff Dismukes, good to have you this morning.
Nice to have you, or
All
nice
right.
to be here, sorry.
It is, I've been a long career for you to Oklahoma State Department of Mental Health and Substance Abuse Services, which is a long title. Now you're with a nonprofit with another long title.
Mm-hmm.
But let's start with what you've been doing for the last couple of decades, all right? When you started, and I knew you and began to understand what the behavioral health controversies were, just understanding was one of them. How far has the public and the media come in the last couple of decades in understanding what comprises behavioral health challenges?
You know, we've made incredible progress over the last 20 years. I hope that I've had something to do with it in elevating that discussion.
You have.
But the things that we didn't talk about 20 years ago were the realities of recovery. The fact that these diseases are identifiable and treatable, and that people can be well. What we did cover 20 years ago were all the negative stories. And frankly, that just helped push back more on the stigma that exists and created more barriers for people to seek treatment. The media has been fantastic in this. You've been great with this and helping to elevate this topic over many years. It is a complex issue. And it's difficult to talk about, and it's difficult to get across in 30 seconds or in a couple of column inches. But we've seen more people trying to engage with those difficult stories. We've seen more discussion about the realities of recovery and the realities of these diseases. Now, I hope that we're going to continue to progress forward on this, because there's still some things that we can do better with. There's discussion sometimes that occurs about this that still centers, let's say, on the criminal justice intersection between it and behavioral health. And to the point that I think some people believe that everybody with a mental illness is engaged in the criminal justice system. That's just not true. There's somewhere between 600,000 and 1 million Oklahomans who deal with behavioral health disorders every year at varying degrees and stages of illness. The vast majority, the overwhelming majority of those individuals are working. They're in our communities. They're part of our friends, our families, and they aren't engaged in the criminal justice system. That's really what we need to start talking about. We need to start talking about the realities of these diseases. The fact that there are people who need earlier access. Maybe their insurance isn't working. It's a great topic to be talking about. Or let's talk about workforce issues and the challenges that we have there. We have an opportunity to expand this discussion even more and advocate, from my standpoint, on behalf of all Oklahomans so that we get them the services that they desperately need.
It's a discussion that's difficult.
Yeah.
Let me give you an example. A month ago, I believe it was about a month ago, we had Representative Marcus McIntyre here, a very long hot seat, it was an extended hot seat, about the issue of uploading mental health records. It was a big controversy about the statewide database. He came here, he answered every question. I asked him, I said, a lot of this noise that's in the background, is it just people don't understand? Or he hinted it was misinformation, right? He laid it all out. One day later, a national radio network had the wrong information, and they were very emphatic about it. You've told me about this before, where that you struggled to get the public and media on just agreeing to what the truth is.
Right.
So as an advocate now, as opposed to just information, is that something that's going to be part of your mission?
That's definitely part of our mission, and we want to include and have those difficult conversations, because they can be difficult conversations, but spend the time to really educate people about reality. And I'm happy about the passion that so many people have around these issues, and that they're excited about doing something about the issues. But we need to make sure that everybody understands the truth about the issues, what this really is, how these diseases impact people, and what these diseases actually look like. And I think there's more work to be done there. I'm looking forward to engaging in that with both the media and the public. It's vitally important also that we bring issues to the forefront of public attention that impact them. So many people don't understand that they have the ability to come back in and make change happen. And we need change to continue to happen. I'm excited about the things that have happened over the last few years especially. I mean, look at what's going on in the legislature and them looking at behavioral health issues. That wasn't happening 20 years ago, and I'm excited that that's occurring. Then we have people talking about workforce issues. We have people talking about the integration between behavioral health and primary care. We must continue those discussions and make a difference.
Let me give you some controversial ones
Yeah.
to knock down here. Okay, insurance. Insurance doing enough in this field, just generally across the board in the United States?
Well, the short answer is no. That has been a barrier to care for forever. I mean, we've been talking about this. Actually, parity laws that were passed 30 years ago really haven't been enforced. But there is some movement that's happening right now. There's opportunity. And it's not really fair to just turn around and say, well, insurance isn't doing what they're supposed to. The rest of us have to help insurance do what they're supposed to. We have to advocate for these issues. We have to find where that system is not working and bring everybody to the table. So that includes insurance. It's groups like mine that represent individuals that are in need of care and being able to speak on behalf of those individuals. It's about bringing the workforce in and the medical individuals and decision makers in on this. It's about bringing legislators in, everybody who's a stakeholder in the field, and about having those discussions and finding solutions. And really, that's the key. Instead of talking about issues, instead of criticizing things, let's get engaged and let's find real solutions.
A couple more that I wanted to ask you about. One is that everybody, in terms with defense attorneys, everybody who shoplifts has got mental illness, or every time that there's a mass shooting, well, that's a mental health issue. I think you had told me one time, well, on that, give us the money to impact it, right?
Yeah.
So let's talk about that. There is a lot of misinformation about behavioral health and crime, a lot of misinformation about behavioral health in these mass shootings. Help us understand what the truth is.
Well, the truth is that every time you see one of these mass shootings, it's not necessarily a behavioral health issue. As a matter of fact, most of the time it's not. And violence isn't something that is necessarily going to occur with a behavioral health disorder. I'm not saying that it doesn't ever occur and that it doesn't ever impact. But the majority of times it's something else. Again, these are complex issues and many things are engaged there. I do think that what we want to do, if this is what we're going to point to, then we need to really look at the system, look at early intervention so that we can head off incidents before they occur. That starts when we're young and our children being able to have access, people being able to access services early in that disease process. Because the reality is, it's like any other disease. If you don't treat it early, it progresses. And when it progresses, it becomes harder to treat. And it becomes harder to recover from that. So that is going back to the stigma discussion that keeps people from engaging early. But that also is about making those services more accessible, which ties into the insurance issue, that ties into the workforce issue. We need to sit down and have conversations about all this and understand the reality.
All right, as you assume the helm of DBSA, did I get that right?
You got it right.
Okay. As you assume the helm over the next year, what do you want to do there?
Well, I think it's really about expanding advocacy and continuing to reach into the communities and provide those resources to families. We do support groups throughout the state of Oklahoma now, engage people and help them to address their behavioral health needs. But we also are working to help people be better able to engage in those treatment services that they have available. We want to work to help navigate the treatment system for individuals and families across the state, help link them to those right services. And we want to hear where they are finding trouble within their own lives and being able to access the services they need so that we can then elevate their voice and seek change. DBSA is an incredible organization. I've been involved with them forever. The roots of the organization go back into the 80s. The people who I'm involved with, and I'm so honored to be involved with on the board, are people that have been very influential in my life. They are very caring individuals. The opportunity to come forward and them offering me this opportunity was humbling. All I want to do is work on behalf of all Oklahomans. I want to make the organization proud, and we have great people involved that are going to be helping me to do that. And I want to help my friends, my family, all Oklahomans to be well.
Well, really appreciate what you've done for the last decades there at the state and now at DBSA. I've heard the two folks that for 2 decades I listened to understand what's going on, Terry White and Jeff Dismukes, the dynamic duo of understanding behavioral health, and appreciate you being here
Thanks
today.
a lot.
Best of luck in the new gig.
Thank you.
Thanks again for watching Hot Seat. See this again at news9.com/yourvotecounts. Follow me on Twitter, Facebook, LinkedIn at Mitchell Talks.